I love nurse practitioners and prefer nurse practitioners over MD clinicians. Today I had to go for an appointment, and usually, you know, I try to really not go to a doctor's clinic. And if I go, it has to be like a really bad situation, and then I force myself, I have to go there. But today I went there for my maxillary sinusitis, which I'm still having trouble with. And I was met with a nurse practitioner, and of course she's a black woman. She was brilliant and so empathetic and so kind. Usually I meet with MDs and they are not, and I never feel comfortable to share my autism diagnosis with any of them, and I don't do that. I usually kind of think about it and I'm like, no, it's not worth it. And I shared that with her primarily because I think I'm in a burnout. When I'm in a burnout, I know I'm super slow. Words don't roll out of my mouth and words don't form in my head. I have all sorts of issues then. So that's what I was dealing with today. So I was in a place where I really had to tell her because I was pausing and thinking, all those kind of situations. And I told her, and I met with a very empathetic, kind woman who asked me about, what are your sensory issues? How can I accommodate that? She had to literally put a endoscope up into my nostrils, and that was not very pleasant, but it was fine. But she was very, very kind. I really, really value that kind of empathy and the way doctors really need to see patients, right? So we're not just something that they can make money off of, but they need to see us as people, and I really feel nurse practitioners do that. There was also a junior doctor who was there taking notes, etc., and she was telling me, like, I was able to tell her that I prefer nurse practitioners over doctors anytime. So my PCP, my primary care provider, is a nurse practitioner, and whenever I've had nurse practitioners, I've really been seen. So thank you to all the nurse practitioners, and especially today when I really needed to hear some kind words, empathy. I really, really value you.